coming today. So this is Hearing Awareness Week, second last day of Hearing Awareness Week of 2017. So it's for the last week in August every year. And so Hearing Awareness Week is to raise the awareness of hearing loss and to highlight the needs of people who are hard of hearing and deaf. And it provides an opportunity for the 22% of people aged 15 and above basically express their views and their needs to people within Australia. It allows them to share their experiences and their knowledge and to create a greater understanding of the needs and their aspirations. And so we've got 3 speakers today from 3 different kind of areas within hard of hearing and the deaf world. And so I'll give you a different point of view and a different bit of knowledge and information about how things affect them or different ways in which you can support people.
I'll take this opportunity now to introduce our first speaker for this afternoon. We have Kylie Webb joining us today, who in 2014 was diagnosed with neurofibromatosis type 2, which, as some of you may know, is a hereditary condition which causes bilateral acoustic neuromas and an increased risk of other tumour growths across the body. One of Kylie's biggest challenges has been her loss of hearing. And Kylie currently runs a blog called Living with Sneaky Tumours, and today she will share her journey and experiences with us. Thank you.
Thank you. So most of what I was just about to introduce myself, Amina just said. So this is Sneaky, obviously on behalf of the Sneaky Tumours that I have, and it's the Children's Tumour Foundation mascot as well as my own mascot. Okay, so what is NF? Neurofibromatosis is a group of 3 genetic conditions which causes benign tumours to grow on nerve endings anywhere in the body. The 3 types of NF are NF1, NF2 and schwannomatosis. NF1 affects up to 1 in 2,500 individuals, whereas NF2 is rarer, affecting 1 in 30,000 people. The most common features of NF2 are benign tumours which grow on the 8th cranial nerve in both ears, which often results in hearing loss and issues with balance. The Children's Tumour Foundation of Australia is a not-for-profit organisation dedicated to providing information, resources and support services to children, their families and adults living with NF. Presently, there is no cure for NF. This is my story. So in September 2014, I attended the live set with Casey Chambers at the Milwaukee Auditorium. On the days following the concert, I noticed the tinnitus that I usually experience had worsened. After a month of no change, I decided to seek medical advice. After numerous appointments with the ENT, an MRI discovered bilateral acoustic neuromas. Acoustic neuromas, otherwise known as vestibular schwannomas, are benign tumours that occur on the nerve for balance leading to the inner ear. Before my diagnosis of NF2, I was oblivious to the strong family history of the condition, for we had lost contact with my dad's side of the family since he passed away. I had always put my loss of hearing and tinnitus down to the chemotherapy I had received when I was a teenager. After obtaining the results of the MRI, I was referred on to Associate Professor Robert Briggs and Professor Andrew Kay, both who have had extensive experience of treating people with NF. Mr. Briggs sent me for both a hearing test and a balance test. With these results, as well as the results from the MRI, it was decided immediate treatment was not necessary. My immediate relief was short-lived after an MRI of the spine discovered a tumour that needed to be removed as soon as possible. 2 weeks later, February the 3rd, 2015, I was admitted to the Royal Melbourne Hospital where the tumour at L4 was removed by Professor Kay. I will never forget the feeling of relief of waking up after the surgery and being able to wiggle my toes. Although I now live with constant nerve pain down my right leg, I will be forever grateful for my ability to walk. In July 2016, after a routine MRI, I was delivered news that I'd thought I would not be given for a long time to come. The left acoustic neuroma had grown 3 mil in 7 months. While that doesn't sound like a lot, 3 mil in 12 months is classed as a large growth. Mine had done that in half the time. Professor Kay talked me through both surgery and radiation. He admitted he was not a fan of radiation, as the likelihood of controlling the growth of the tumour in an NF2 patient is substantially less than in a patient that doesn't have NF2, and there are increased risks. Professor Kay explained the surgery would be translab craniotomy, which is behind the ear. The surgery would leave me deaf in that ear, and there may be a possibility they would have to leave some of the tumour behind to preserve the facial nerve function. Radiation may be necessary in this case to prevent further growth. I was disappointed that Mr. Briggs wouldn't consider an ABI, which is an auditory brainstem implant at this stage, due to the level of hearing I had on my right side. I was due to go on my first overseas trip to America in September. I was relieved when they both decided it was safe for me to still go. On the 30th of November, I underwent a 9.5-hour operation to remove the acoustic neuroma. I was lucky I didn't experience the seasickness-like symptoms post-op that most patients do. However, the recovery from the surgery hasn't been an easy road. The facial paralysis on the left-hand side of my face made simple tasks like eating and drinking very difficult. My eye was unable to close and was extremely sensitive to light and wind. It required regular drops and had to be taped shut at night. I underestimated the fatigue I would feel after the operation, and for the first couple of months post-surgery, my concentration levels were very low. So this audiogram on the left-hand side was done about 2 or 3 months after I was first diagnosed, and the one on the right was done about 3 months post-op. So the biggest challenge I face living with NF2 is the loss of my hearing. Although the recent surgery has left me deaf in my left ear, I found that the clarity of noise I hear is so much better now that I don't have to contend with the murmurs I was hearing in my left ear. I am highly sensitive to noise, which is difficult considering most people assume because you have a hearing impairment, they need to shout at you to be heard. I struggle in most social situations to follow what is being said if there is a lot of background noise or the room is full of hard surfaces. This can be terribly isolating at times. I come home from work every day mentally exhausted, particularly if I had to attend a meeting where I had to concentrate on what was being said and follow where the noise was coming from around the room. I more often than not get people's names wrong or misunderstand a conversation, for I tend to only hear the middle part of the word and have to guess what was said. If I am taking a phone message, I always repeat the number and message back to them to ensure that I have got it right. If I could educate everyone on how to speak to people with a hearing impairment, this is what I would tell them. So don't cover your mouth while speaking. Without the visual cues, it's almost impossible to know what is being said. I particularly find it hard when people have mustaches or beards and are trying to talk to me, or heavy accents are something that I don't follow either. Speak clearly and don't mumble. Face the person, don't try and talk to their back. Get their attention before beginning to talk. A major example of this is just recently I went to visit my GP and he had a dictator on, so his mouth was covered as it was. He has a heavy accent and he spent the whole time talking to the computer, and it was my partner that basically had to be the translator in between because he wouldn't face me, and even though he knows that I have the hearing impairment. My biggest hate is when someone says never mind. If it was important enough to say it in the first place, then it was important enough to repeat. The idea of living in a silent world scares me, but sadly one day this will more than likely be my reality, as removal of the remaining AN will leave me deaf. I try and live life to the fullest and not dwell on the hand I've been dealt with, although this isn't always easy. I developed a bucket list of things I would like to tick off, an opportunity to take in as much sound as I can before it's too late. Since June 2015, I have ticked off items such as listening to the roar of a crowd at the football match, bagpipes, live theatre, an orchestra, and hearing the last post. And of course, listening to Casey Chambers, which I think she probably thinks I'm a stalker because I'm now up to concert number 4, and I made it my challenge to meet her and to thank her. Without her, I wouldn't know about NF, and more than likely, I would not be walking today. So raising awareness about NF is something that I am extremely passionate about, along with raising funds for the Children's Streamer Foundation. So I'd like to thank you for giving me this opportunity to come and talk to you today and explain a little bit about NF and obviously how hearing affects not just me, but a range of people and how you can help them. So thank you. Is there any